Adriana. I'm going to be seeing you today, okay?
Okay.
And do my hand hygiene. So are you here just for an annual assessment?
Yes.
Okay, great. And can you tell me your first and last name, please?
Gabriella Mantilla,
And your birth date?
November 13, 1993,
Good. And what year it is?
2026.
Great. Okay, let's get started. So since I was looking at you, I took a look at her skin, her appearance, as she appears clean. She's alert and oriented, so I can go ahead with my exam. I'm going to start with your eyes, okay? I'm going to take a look at this chart here, and I'm going to have you cover your right eye. And can you read the lowest line for me that you can see?
LTFPH.
Great. And can you cover the other eye, and then we'll do the same thing.
LTFPH.
Great. And then with both eyes, read the smallest line you can backwards.
HPFTL.
All right, very good. So 2020 here. I'm going to go ahead and take a look at your eyes. So just follow here this pen with just your eyes, not your head. Good. So this is checking her extraocular nerve, which is intact. I'm going to place it closer to you. Very good. Her pupils can accommodate. I'm going to check your peripheral vision. So cover the same eye as me and tell me how many fingers I'm holding up looking straight at me, okay?
2,
Good.
1,
Good.
2,
Try again.
3,
Good.
3,
Good. Same thing. Just look at my nose, okay?
2,
Okay.
5,
All right.
2,
And last one.
1.
Very good. All right, so I'm going to flash a light in your eyes, okay? You can just look straight at me. Very good. So both pupils constrict at the same time. I'm going to flash it right straight at your eyes. You can look at me. And the light pops up the same in each eye, so it's symmetrical. I'm going to flash this light again at you, and I'd like you to cover your left eye, okay? Go ahead. And then uncover. Good. And then you can do the same thing with the other eye, okay? Good. And check again. Very good. So here you can see that, okay. So here you can see that I was testing for nystagmus, and she has no signs of that, so that's great. I'm going to have you look up. I'm just going to check your sclera and your conjunctiva here, and look down. Very good. Now I'm going to get a little bit of a different thing to look into your eyes. This is going to look deep into your eyes. You can just look straight ahead, okay? So as I'm doing this, I'm taking a look in her eyes to see the red reflex, the optic disc, and cup. I'm going to do the same thing to the other eye. Again, just look straight ahead. Very good. Looks great. And can you lift your eyebrows up for me and close your eyes really tight? Very good. We're going to go ahead and move on to your mouth. Can you open up for me? Great. So I'm taking a look at the gums, the teeth. Nothing is, teeth aren't broken, missing, or cracked. The mouth is pink and moist. Can you stick your tongue out and say ah?
Ah.
Good. So we have that cranial nerve intact. I'm going to give you something to taste. And what taste is that?
Cinnamon.
Very good. So that's intact. If I have gauze in my hand, I'll place it on your tongue. And can you lift up and down for me to make sure tongue muscle is strong and cranial nerve is intact? Very good. Can you smile? Awesome. So now we will go ahead and move to the nose. I'm going to palpate your nose and your face. Let me know if you feel any tenderness. So starting on the bridge of the nose, just going down and down the sinuses. Any pain here? Everything is flat, not swollen. So that is good. I'm going to look into your nose. So let's change this. All right, and can you tilt your head up for me? Just going to press right here. Everything's patent. Looking good. And can you smell this and tell me what this smells like?
Cinnamon.
Good. So that cranial nerve is intact. We will move down to your neck and your throat. So I'm going to come over here and palpate your lymph nodes. Let me know if you have any tenderness. They are non-tender, non-swollen. So far everything looks good. Awesome. So now I'm going to go ahead and palpate for the trachea and the thymus. Can you swallow for me? Very good. Press your head against my hand, okay? Awesome. And the other one. Good. Now swallow one more time for me. Good. And can you shrug your shoulders up and down? Great. Now I'm going to go ahead and listen to your neck. So at some points I'll just ask you to hold your breath, okay? Other
Okay.
times you can breathe normally.
Okay.
I'm going to come over here and hold your breath. Very good, and breathe normally. And we'll do it again. Okay, and then you could just breathe normally, okay? Very good. Okay. So then we'll move on to your chest and torso area. So I'm going to take a look at the back of you first. I'll move your hair to the side. And you're going to feel me press on your back and touch your back a bit. Everything feels smooth, skin is warm. And then I'm going to palpate, making sure the sounds sound the same bilaterally. Taking a look at the AP lateral diameter as I move around her. And now I'm going to listen to your lung sounds in the back, okay?
Okay.
So when I press the diaphragm onto your skin, I'd like you to take a deep breath into your nose and out through your mouth.
Mm-hmm.
Go ahead. Great. Good. And again. So what I'm doing is I'm just listening to the sounds bilaterally so that I'm able to compare them. Almost done. Last one on the back. Great. So now I'm going to move over to the front and I'm going to palpate for any fremitus on the chest, and same thing, looking at the skin smooth and the temperature. I'm going to make sure everything is the same. Come down here. Okay, and then I'll listen to her lungs. So same thing we did before, okay?
Okay.
In through your nose, out through your mouth. Good. Mm-hmm. And I'm going to come down here. You can continue. And then wedge each side a bit under your arm. It's okay. And then this one. Great, you could breathe normally.
Okay.
So all lung sounds sounded clear, and even no adventitious lung sounds that I heard. I'm going to ask the patient and help her to recline. Go ahead, and you put your head back, and please look at that corner of the room. So I'm going to take a look at her neck. See that there's no jugular venous distension, and then I'm going to go ahead and palpate the front of her chest. So I'm going to look here at the carotids one at a time. Before I heard no bruit, so it's okay for me to palpate. And then I'm going to palpate her sternum here, down to the xiphoid process. Taking note that here is the second intercostal space, the aorta, the aortic valve. Here is the pulmonary artery. And then I'll go to the fifth one, and the mitral and tricuspid. So those are spots that I'll want to listen to. And I'll do that with the diaphragm and the bell. You can breathe normally, okay?
Okay.
Very good. Great. Then I'm just going to listen to some other spots on your stomach and your hips. So if you can move your hands to your side. What I'm going to be listening for here is her aorta. The renal arteries. The iliac arteries. and the femoral. Okay, very good. I'm just going to take a look at some of the other vessels in your body. So I'm going to place my arms here and test the pulses that they're 2+ in strength and equal on each side. I'm going to come down your popliteal. Okay. Posterior tibialis, and then her pedal pulses. As I was doing that, just checking for warmth, temperature. I can take a look at her capillary refill to make sure that it's within 3 seconds or less than 3 seconds. Great. So last thing we have to do is look at your ears, and then you'll be all set.
Can I sit up?
Yes, you can. So I'm going to take a look at your ears. I'll push your hair back. Taking a look at color, symmetry. I'm going to palpate. Let me know if you feel any pain. The tragus and the pinna here. Then I'm going to take a look. I'll have you look straight ahead. So I'll pull her ear back, look into her ear, and see that I can see her tympanic membrane, pearly and gray. No signs of edema or redness. Let me do this. All right, very good. Then we're going to do a couple tests.
Okay.
So I'm going to strike this, and you're going to let me know when you stop hearing it, okay?
Okay. I don't hear it.
Good, so that's to test air conduction. Now I'm gonna test bone versus air conduction. So each ear, I'll strike it, let me know when you can stop hearing it.
I don't hear it anymore.
Okay, let me know when you can stop hearing it from here.
I don't hear it anymore.
Okay, so now I'm gonna do the same thing on the other side to see that they are the same bilaterally.
Okay. I don't hear it.
Okay, and here.
Okay, I don't hear it.
All right, very good. So if those were the same bilaterally, then that would be a normal finding for the patient. Next, I'm going to go behind you and I'm going to whisper a word. I want you to cover the ear that I'm not behind, so you can cover this ear here, and I want you to tell me which word you hear, okay?
Okay. Orange. Watermelon. Basketball.
Very good. And then I'm going to come over here, so standing 2 feet behind the patient. I'm going to whisper some words again.
Raspberry. Strawberry. Basketball.
There you go. Hearing sounds great. Looks great. Hears great. So last thing that I didn't do is I'm just going to palpate here so that I can count the patient's heart rate. So I'll do that for about 30 seconds and I'll multiply that by 2. I'll tell the patient that I'm doing it for a minute. So for the other 30 seconds, I can count her respirations without her being aware of that. And a normal heart rate would be between 60 and 100, and a normal respiratory rate would be between 12 and 20. So as long as those numbers are between there, then she would be within normal limits. And I think that's all I have for you today. Do you have any questions?
No.
Everything came back great, so we'll be in touch. If you have any concerns, please call, okay?
Awesome. Thank you so much.
You're welcome. And that's that.